First and foremost, as businesses continue to flex open voluntarily, the state has made sure that masks will be available to them. And I really commend all the folks at the state level for providing not just a gateway to request those masks, but an actual system that has worked very, very well in terms of making sure that we can provide those masks to all the different businesses making those requests at the nh.gov website. To date, we've sent out thousands of orders and with millions of masks to businesses all across the state. We continue to secure masks and other vital pieces of PPE on a constant basis. Earlier this week, we secured another 7 million masks. They arrived here in New Hampshire, which will be sent to healthcare facilities and small businesses across the state, and we expect another 10 million masks to arrive later this week, which is terrific. The state worked with the Body Armor outlet in Salem, New Hampshire. Body Armor, another one of our private partners, a great public-private partnership to secure these masks, and obviously we can't thank them enough for their help. So many different businesses have been stepping up and actually providing this gateway, not just for us here at the state level, but for all the citizens and businesses across New Hampshire. The public-private partnerships are a true team effort, and in total, approximately $25 million has now gone towards New Hampshire companies manufacturing, procuring, and securing PPE for the state of New Hampshire. Two other New Hampshire companies, Circular Blue over in Bradford and Coltac LLC in Unity. So Circular Blue in Bradford, Coltac LLC in Unity, they've both delivered over 50,000 gowns for the state, either through retooling or repurposing their manufacturing, with many, many more to come through the coming months. Securing gowns continues to be not just for New Hampshire, but for governors all across the country. We hear it's one of the toughest things to secure in terms of PPE. It's a very high need item, a little more complex to make than a mask, and we cannot thank them enough. These are very high need items for us right now. So 50,000 gowns for the state with more to come is just tremendous, tremendous news. As we respond to the COVID-19 epidemic, we continue to emphasize action in our long-term care facilities. So a few weeks ago, we did launch the Long-Term Care Stabilization Fund to ensure that critical staff have the support that they need for some of New Hampshire's most vulnerable individuals, those with physical disabilities, developmental disabilities, older adults. We want to make sure that they can get uninterrupted care during the entirety of this COVID-19 emergency. To date, the state has approved 282 applications from eligible long-term care facilities. In total, the $300 weekly stipend that we created is now going to over 22,000 workers across the state. So that was approximately what we had anticipated would be the demand on the program. We anticipated it to grow a little bit in the coming days, but since its launch, more than $6 million in payments have gone out the door, with another $5 million committed a week going forward. So a lot of good forward progress in that front. And every day we get new applicants, we look forward to providing this incentive to all those who are on those front lines as part of that program. Another aspect of long-term care we're tackling is making sure that we have a consistent workforce on the front lines. And on Monday, I signed an executive order that broke down barriers to ensure that we can maintain critical workforce, specifically in our long-term care facilities. Individuals who wish to answer the call to help staff our long-term care facilities can now undergo an online training program to become temporarily licensed to perform certain tasks in long-term care facilities. I'm now going to turn it over to Commissioner Shibinette, talk a little bit about the long-term care situation and a public health update. Commissioner.
Thank you. Today we are announcing 63 new cases of COVID-19 in New Hampshire for a total of 3,299. 7 new hospitalizations, and that's staying right around 10%, and 8 new additional deaths, 7 of which are at long-term care facilities. We will be releasing a new chart this afternoon with our long-term care facility outbreaks. We do have one correction to make on Aurora Assisted Living in Derry that we had reported out over 60 positive cases last week, and that number was incorrect. Their current numbers are 21 residents and 12 staff. So we will be doing a corrected version of our table with those corrected numbers in it later today. A testing update, we are averaging 1,478 tests a day with a 5.5 positivity rate, including an average antibody testing number of 211 antibody tests a day on average, with under a 3% positivity rate for those tests. Since announcing our long-term care testing project last week, we've tested over 1,500 residents and 1,700 staff, including over 500 residents and staff at Hillsborough County Nursing Home yesterday. We've estimated that between 30 and 40% of all long-term care nursing home residents have been tested to date in the state of New Hampshire, and we still anticipate that all nursing home residents will have been tested within 2 weeks. Concord facility for testing opened today with great numbers. Our state sites collected our fixed sites collected over 1,000 specimens themselves yesterday. Additionally, there has been some feedback about Manchester, Nashua, and the lack of fixed sites there, although our mobile sites do go into those areas. So I just wanted to announce that Manchester Public Health runs ongoing clinics in Manchester, and if any Manchester citizen that wants that meets the criteria for testing, which is the same as our fixed sites, which is all of those high-risk groups, over 60 healthcare worker. They have a Manchester COVID-19 hotline, 668-1547. You can call Manchester Public Health to get a testing appointment. Nashua Public Health is also running clinics. Both of them have done a great job. They're running both community clinics, and they're also testing all of their elderly housing, not long-term care facilities, but independent elderly housing, so they've done a great job. Nashua Public Health also has a COVID hotline, and to schedule an appointment, you can reach them at 589-3456. The other announcement I have is we did get remdesivir in yesterday. We did get our 400 vials of that in, and we did distribute that the same day out to 13 different hospitals. The hospitals that received some of that remdesivir: Catholic Medical Center, Cheshire Medical Center, Concord Hospital, Dartmouth Hitchcock, Elliott, Southern New Hampshire Medical Center, Exeter, Frisbee, Parkland, Portsmouth, Lakes Region, St. Joseph's, and Wentworth Douglas. All of them have received the emergency use authorization to go along with that medication, and have agreed to use that medication along the lines of the emergency use authorization that typically has a lot more guidelines and paperwork requirements to use it. That is all I have to report.
Thank you, Commissioner. One more item to talk about a little bit. The state also received, through the direct Department of Justice CARES Act grants that came out of the CARES Act 3.0, as we call it, the ability to send for New Hampshire $575,000 to police and fire departments across the state to purchase things like ventilators, PPE, supplies, and cover a lot of their overtime costs. So the Department of Justice is releasing those grants. Those release of those emergency funds will obviously provide a lot of New Hampshire's communities with the means to purchase life-saving equipment, things they really truly need on the front lines. And while allowing municipalities with a demonstrated need to hire additional first responders as part of their efforts to respond to COVID-19. So again, just a great job by the folks at the Attorney General's office, working very directly with a lot of these local communities. When the money comes in, they get the relief out quickly, and I think at the local level it provides a lot of opportunity for these communities to be able to respond to whatever the need might be for their citizens. With that, we can open up for questions.
A couple weeks ago, you guys were saying the goal is 1,500 tests per day, and you were there. Why has it been so hard to hit that number and stay, or even get above 1,500 per day?
Why has it been so hard to get to 1,500? Well, I mean, if you go back to start at the beginning, we were doing 100, 200 tests per day. The limiting factor was really about having the supplies, those testing kits and the supplies, and it isn't just the ability to do a test. It's the staff and the staffing to do it. It's about having those RNA assay extraction kits, different aspects of the test, because there's a couple different tests involved. For those who are doing a Cepheid test, you need the Cepheid kits, or the Abbott Rapid test, you need the Rapid Abbott test kits and cartridges. And those that are doing more of the traditional testing on the Fishers, the larger Fisher machines, just making sure that, again, we have what we need. As production has ramped up across the country. We've simply been able to get more kits. So that's provided the opportunity to get where we are. But we want to keep going, right? We want to keep pushing that level a little bit. So if we can average around 1,500 right now, that's a good place to be. That was our goal, and I really commend Commissioner Shibinette and their entire team for getting us there. Also, now we want to take additional steps. Now, one area where we're really looking is now that hospitals are opening up, now that folks are doing a lot of this outpatient surgery, that's where we think a lot of the testing demand will come from. As people are going into hospital settings, they may be tested coming in and potentially even going out, depending on the procedure they might be getting. So we anticipate a lot more tests being able to be utilized in that setting, and that's where we'll really lean on some of the facilities like Dartmouth Hitchcock and others to provide a lot of that testing capacity and likely increase this well over the 1,500 threshold. They're still not quite at their capacity of doing tests, which is still an opportunity for us to go above and beyond the average of 1,500, the goal that we set for ourselves. So.
Are you going to set a new goal higher, or I guess, should we expect to stay where we are, or are you aiming?
I think we should always expect it to go higher. I'm never satisfied. I don't think any of us.
Like a concrete goal.
I haven't set a new number. Kind of as we got to 800, I asked the commissioner, hey, let's get over 1,000, and as we approached 1,000, I said, let's get over 1,200, and as we got to 1,200, I said, let's get to 1,500, and I know she's wondering what the next number will be, but but no, we're always challenging ourselves to do more, and they've done a fantastic job. I mean, the fact that you can now request a test online and self-attest to it, you don't need the doctor's note or any of that anymore. I did not think we were going to be here just a few weeks ago, but we have. So I'd like to keep setting those goals and charging ourselves with where we can go. Something to remember, a test tells you where an individual is with their COVID status today, but it doesn't mean you're not going to get infected tomorrow. So even though you've had a test, there's a lot of folks, especially in long-term care facilities, we will want to and plan to go back to repeatedly to make sure that we're constantly monitoring those highest hit areas. So I don't have a specific number in mind, but it's over 1,500, and we're going to keep striving to get there.
My recollection is last week, it was represented that by the end of this week, we might be near 2,000 tests a week.
Sorry, Commissioner. Yeah, sure.
So the number that I read to you is the average, and there's always a day or two in that 7-day period that are down days. So our testing number for yesterday, which excludes the hospital data, was 1,912. So there is always going to be a day or two during the week, and usually our low days are on Tuesday, Wednesdays, because they represent the collection days of Saturday and Sunday. So this day would typically be a low day for us. So based on, I do believe that 1,912, by the time we get our hospital data tonight, we'll be over 2,000, and I do expect to be over 2,000 a couple of days this week and into next.
So I guess we have to set our goal above 2,000 now. No, but that it really is fantastic news, and I think, again, it isn't for our benefit, and it puts a smile on my face, but I think the citizens of New Hampshire should know the opportunity is going to be there, and it really allows us to segregate this and mitigate the spread of this that much quicker. Kevin, did you have one?
The University of Washington IHME model has been updated, as I'm sure you've heard, and it projects as the worst case scenario for New Hampshire 900 deaths by the end of next year. Do you think that's possible, and do those kind of dire predictions make you anxious about opening up further parts of the economy?
So does the University of Washington model predicting 900 upwards of 900 deaths for New Hampshire make me anxious? Of course it does. Absolutely. That's a very dire number, but it could happen, which is why we have to be extremely careful. I know a lot of people want the economy just to open up quickly. Something that we've really been talking about is two things. Number one, models are fine, but data trumps models. Data trumps models, and that's where I think Dr. Chan and his team have done a very good job of looking where we are today, using what we know, the trends that we've already seen. It's nice to know where somebody in different models think we're going to go, and there's literally dozens of models out there. The University of Washington model is one. There's others out there. Some really focus on high density areas. Some really consider more rural areas where there's just naturally more physical distancing. Some look at there's lots of variables in there. And so not that any of the models are wrong, but I can tell you none of them are right? Because none of them are exact. And so you have to understand that it gives you a good guide, but our decision making is really based on our data. I can tell you that one thing that I'm looking at now is, and asking the team to look at it and go back to look at, is what I guess you'd call kind of super outbreaks, right? So for example, the events, some of these singular events we've heard of in the news and across the country. For example, the biotech conference in Boston. One event, couple hundred people get infected in a matter of hours, and that really causes a massive chain reaction all throughout Massachusetts. It isn't the only reason Massachusetts is having a tough time, but one of the many. It's a very international state, very international city, a lot of international travel. But clearly, that was a singular event. The choir practice we hear about in Washington, where one individual, again, over a 2-hour span, infects 100 people, and it really goes like wildfire there. There's other stories like that. And so one thing we're looking at is how do we make sure that we don't put ourselves in those types of situations? A lot of folks will have asked me, well, if the risk is really to just people above 60, 60 years old for the most part, why don't you just open up everything for those under 60? Because those under 60 can very easily be a transmitter, and in most cases are the transmitter to maybe a grandparent or someone in their community or somebody at work, whatever it might be. So it's, again, our concerns across the entire spectrum of our communities isn't just about those that could be hospitalized and are at the highest risk. The concerns are about the transmissivity and doorways that we could possibly be opening that put those individuals at risk as well. So as we take additional steps, we have to be very careful, and looking at those super outbreaks is something that I think is going to be a key aspect to be able to have us consistently hopefully take small steps to open things up, whether it's on retail or beaches or whatever it might be, but also not put us into a situation where we're going so fast or opening up things that are truly of the highest risk nature that could put us in a situation where, unfortunately, the Washington model may play out. We don't want that to play out. We know we're going to have more fatalities here, unfortunately. We know we're going to have potentially a lot more COVID here in the state. It's really about how do we manage it. Have we flattened that curve? And maybe people are sick of hearing me talk about it, but boy, is it important. It's all about the ability of our healthcare system to manage any potential surge. So if we, right now I think we have about 120 or 130 hospital beds currently being occupied by individuals with COVID. Well, we have thousands of beds available. So we know we have capacity. Even if there were a bit of a surge, we know we can manage it. If there were a bit of a surge, we know we have more pharmaceuticals coming in. We know we have ventilator capacity as well. Those are going to be the most important pieces of the puzzle to make sure that we don't have a run on that healthcare system that is unmanageable. So those are some of we look at a lot of data, as I think everybody in this room understands and most people, I think, appreciate. But, the hospital capacity is a big one. We want to make sure that we don't get to the point where that model comes to bear. And I think just looking at all aspects of this, it means that we can't probably open everything up that we'd like to. We definitely can't do it as fast as we'd like to. Everybody wants everything open tomorrow. That would be wonderful, but boy, that would be horribly irresponsible. So we'll look at those hotspot areas. We'll look at those singular events that can cause a lot of the outbreaks. And I think if we can manage those aspects of our community and still move forward, getting the economy back up to as close to 100% as we can, but being very cautious of those steps that we have to take. It's why with every guidance document comes a lot of scrutiny from the Department of Public Health in our office to make sure that we're being sensible and reasonable about what to expect, not today, but also months down the road.
Well, what do you do about businesses? We've been doing reporting today on businesses that are either not following the guidelines that you've issued or some businesses that are opening up that your guidelines haven't permitted to open up. What do you just hope they close down? What steps are you going to take?
So
I know you don't want to have.
There are definitely a few cases out there, not many, but there are definitely a few cases out there of either individuals or individual businesses that are pushing our guidelines, so to say. And again, we'll work with those folks. They're few and far between, and we're happy to work with them on an individual basis. I think the Attorney General's office, they do their local calls with all the different communities on a weekly basis to really make sure that we're not in a position where we're coming down with a hammer, but trying to work with those individuals. A lot of businesses the model doesn't work for. We know that, unfortunately. But again, we have to make the steps that we need to make to ensure public health and safety while allowing some flexibility for those businesses to open. If they choose not to or it doesn't work, hopefully down the road we can make those steps sensibly to a point where it does work for them, whether it's a capacity issue in their business or how they actually do business. For some it does and some it doesn't. We're just, again, trying to allow that door to open. And if you noticed, we allowed retail to open. And in a given mall, you had less than 50% of the stores on average that even opened this week because they were choosing not to. It's not that necessarily that the model didn't work. Maybe they're part of national chains. Maybe there was staffing issues. We're making sure PPE is available. So we're trying to provide every opportunity for it to work. But every business, someone who ran business, every business is very different, and so you have to be cognizant of that. And hopefully we can get to a point where it works for everybody.
So on the nursing home front, is this what you were talking about? This temporary health worker, can you just characterize the need that prompted that action?
Sure.
I mean, how short of low-level workers are long-term care?
Sure. I think what we're trying to do is not just deal with some of the shortages we have today, which are manageable, but also appreciate where we could be potentially in the future. And as we test more individuals in long-term care facilities, you're going to have an issue where more individuals may need to be quarantined. More staff might be actually positive with COVID, and they have to go home and kind of take care of what they need to take care of for their own health for a couple of weeks. And we just want to make sure that in those situations, you never are put in a situation where the facility has to say, sorry, we have to close shop. And then they end up putting their residents either in hospitals or back home or whatever it might be. You don't want to be put folks in that situation. So we're trying to, I think, be kind of preventative about what we can do. Other states have taken similar action, and it's a model that's worked for them. So again, these individuals that we're going to train up can't necessarily do everything that a full-time staffer and fully licensed staffer might be able to do, but they can do a lot of the ancillary things to make sure your most skilled staff are right on the front lines dealing with the most pressing issues for those facilities, and just gives the facilities some temporary flexibility to help ensure that they won't close their doors.
Have you considered raising reimbursement rates for Medicaid? Some states have done that to address issues.
We just went through a raising of the rates 6 months ago. So I think we're okay in that field right now. We are looking at potential stipends, and we've done that for Medicaid workers in long-term care facilities. And we could look for it for other areas as well. And we're kind of running those numbers and kind of weighing that away.
What kind of area?
Well, it's something that elsewhere we are looking at, I can say, is within those long-term care facilities, I can tell you, I don't know if I appreciated how many folks are contract workers. In those same facilities, working side by side with Medicaid-based patients, that typically those staff typically don't get paid as much. There's a lot of those contract workers that didn't necessarily get covered under the first round of stipends that we did. So it's something that we're definitely looking at.
Governor, can you describe how you think the state will react now that in Maine we see York Beach and Wells Beach moving forward with opening? Are you going to take a wait-and-see approach on that and see how they handle it, or do you think Hampton Beach could be on tap next?
I think right now it's a wait-and-see approach, both with what's going on in Maine and what's happening in Massachusetts. You have different cities and towns that have a lot of say on their beaches. I think they call it a home rule essentially in Massachusetts, and there's a lot of cities and towns on the Mass coastline that have that. So we'll wait to see kind of what happens with those, if there's any additional restrictions that the state tries to put on, or maybe they try to loosen things up. We're not quite sure. They're trying kind of a pilot test, if you will, in some of these smaller beaches just north of our shores. Well, we have the ability in that it is May 13th. It snowed a few days ago, so there isn't a mad rush to the beaches right now, which is good news because that allows us to see, how their model plays out. How do they manage parking? How do they manage their crowd control? What other type of stipulations are they putting in there? Something that our commission recommended to the Open Up Task Force was making sure you don't congregate on a beach. You can't sit and sunbathe on the beach, but you can use it if you're constantly moving, staying active, and not stopping in large crowds or anything like that. Which, again, something like that may work for us, it may not, but we have the fortune of being in a position where we can actually look at what's happening in some of these other locations and make sure that what we do hopefully aligns with what they're doing. We'll see how the timing might work for us, and maybe look at adjusting our guidance to tweak the model a little bit. Again, they've never been in that position either. They're kind of opening the door, saying what's going to happen. We get to kind of watch to see what happens and hopefully refine our model to make sure it works, whatever the timing might be. It's going to work best for our citizens.
We do see seems like a lot of pent-up desire and demand to get out and do something. Certainly with retail, certain businesses are seeing people line up safely to try and get to do something. How do you reconcile the reopening sort of thrust with stay at home, which is still
No.
in effect essentially. How do those two things coexist?
Yeah, so the stay-at-home order is definitely in place, and we call it 2.0 because all we've really done is flexed open the ability to do some more shopping, essentially, and go to some of these retail or business establishments, whatever they might be. It might be golfing for exercise, might be to a retail establishment or to get your hair cut. But that stay-at-home order really still is in place. We've always let people, don't want to say flex the stay-at-home order, but use the stay-at-home order to be able to come out for exercise and walks and hiking, things of that nature. Being healthy, eating healthy right now, that's borne out to be very much a proven method to making sure that if you were to get coronavirus, you want to be healthy, right? It's those underlying health conditions that can be the most dangerous and be most exasperated, if you will, or accentuated when you get COVID. So we want people to stay as healthy as they possibly can. We're very fortunate. We're in very naturally a healthy state. In terms of it's really about that balance is a little bit about walking that line, right? And taking not just big steps, but sensible, small steps in conjunction with the really smart folks over at the Department of Public Health, looking at data. Everything is very data-driven. We don't look at fanciful models or anything like that. We really look at the data to make sure that what we're doing is based in fact. And that's been, I think, one of our most powerful tools in terms of creating that balance and walking that line. It isn't arbitrary. It isn't put our thumb up into the wind and say, gee, I think this feels right. No, it's really data-driven and making sure that we're providing the best opportunity for individuals while balancing the aspect of public health.
So what do you do? I mean, do you have specific guidelines you've given the Attorney General's office or local law enforcement to handle businesses if they choose to totally flout?
There's not, yeah. So there have been some guidelines provided by the Attorney General's office to local law enforcement about communication and whatnot, and the Attorney General is on the phone with those law enforcement agencies all across the state on a weekly basis. So they're constantly in communication about what issues they might see there, how to have the right approach to individuals if they have questions about the guidance, if people are just actively thumbing their nose at it, how to go about it. We always want to work with individuals as opposed to coming down with a heavy hand, and I think the department and the state as a whole has really handled the situation very, very well. One thing I would remind folks is if you're running a facility that maybe shouldn't be running, that isn't covered, or running an operation in a way that is going well above and beyond the guidance that we've provided, it is not in your interest to do so, in that we want to take additional steps, and we don't want a few bad apples to spoil it for the whole bunch. And if too many folks are really thwarting this very actively, it's going to really prevent us from taking that additional step, allowing more access, because we feel like then we're going to have to clamp things down. So it is in very much a retailer's interest to follow the guidance, or a barbershop's interest to follow the guidance, because that'll give us the confidence that we can take additional steps forward in a safe and sensible manner.
But so are those guidelines or those instructions that you've given the Attorney General's office to instruct local law enforcement, is that a document that's
I haven't given the Attorney General guidelines per se, but I believe
guidance available
I believe
so
they've
people can-
given something. They've had some communication with local law enforcement at a localized level. So I assume it's a public document, or if it's available. Yeah.
Your reopening task force has made recommendations for lodging, for the next phase. Lodging, massage
Yes.
therapists, gyms, passive attractions. Are you gonna wait until the May 31st expiration of stay-at-home 2.0 before you evaluate those, or are you interested in looking at them sooner than that?
Oh, no, we're looking at them now. Yeah, anything that the task force has undertaken and taken a kind of a vote on to move forward, our office and public health are actively looking at. It doesn't mean we're going to move on any individual item or all of them as a whole in any specific timeline. This is a kind of a naturally evolving process. Certain aspects of what they've done, of what they've looked at, are a little easier, frankly, to move forward with. Some are going to take a little more time and understanding of what the guidance is, and looking at maybe how other states and how some of these openings in other states have looked, the pros and cons of what they've done, and how our guidance might mix with that, and give us a better predictive look about what the result might be. Because a lot of our retail has just been opened a few days, we've really just gotten underway here. The restaurant outdoor seating aspect hasn't even gone into effect until this Monday. I think we're still probably a week or two away from really understanding that data. Doesn't mean that we have to wait for every bit of that data before we make another decision, but we're going to be cautious about what we do, to be sure, because I've always said if you take time, you have the discipline to wait a couple more weeks or wait a couple more days, whatever it might be, to get it right, that ensures stronger economic success and stronger success with your reopening approach down the road, whether it be down the road this summer or in the fall or even next spring. The economic impacts of this are going to be felt for quite some time. What we don't want to do is put ourselves in a situation where we go backwards, and the best way to do that is be very careful about the early steps you take. You got to set the tone right. If you come out of the gate swinging too hard, too fast, this is, you use the analogy, but boy, it really is true. If this were a marathon, we're at about mile 4, you don't start sprinting, right? You don't start sprinting saying, I feel good, we're just going to get to the finish and wrap this one up. You can't do that. You're going to be in real trouble, and that's a very true analogy here. You got to have the discipline no matter how good you feel, and the numbers are good. They're getting better. We're on a decent trend here, but my goodness, we still have a fatality rate we have to deal with. We have 60 plus cases a day that are coming in. Percent positive continues to be manageable at 7, 8, 6, 5% on any given day as it kind of bounces around at that low level. That's a good thing to see. But we got a long way to go. Are we going to see other surges? Yes. I believe we will. That's just my guess, but I think we'll see other surges in some form, maybe not as big as they were before, but I think it would be naive to think that there's no other surge coming down the road, whether it be later this summer or in the fall or later this winter. So taking these steps today in an appropriate manner helps us get the data and manage a process that is very unknown to us, so that if we were to hit another surge, we're in more of a known atmosphere. We know what to expect. We have better data, we have better testing capacity, we're always trying to grow that, have more PP on hand. Those are all going to be tools, very valuable tools to make sure that if and when we see that next surge, we're more prepared for it and don't have to take such drastic steps that we had to take the first time.
Governor, the President has said publicly a number of times, anybody that wants a test can get a test. My understanding is that's not the case here in New Hampshire, at least at this point, so just wondering if you can clarify that. And also, if it's not the case, based on the arrival of testing supplies, when do you think we might get to that point?
Yeah, we're not at the point where we can test anybody and everybody, right? We have a lot of flexibility with our testing, to be sure. Self-attesting to just any type of symptom that you might have that could be related to COVID. It allows you to get a test. That's a lot of flexibility. But we are not at the point where just anybody can just go in for any reason whatsoever. We hope to get to that point. I can't tell you when that's going to be. The fact that we did nearly 2,000 tests yesterday, that's pretty phenomenal. But we got to get pretty substantially over that. I think to date, I'm going to ballpark this, we've done well over 35,000 tests in the state, which is approximately, doing some rough math, just shy of 3% of our population, right? Now, some people might have been tested twice, of course, but we're on a pretty good track there. Is that about right, Commissioner? Do you know? 38,000, yeah, so not bad. I still got it. With no sleep, I can still remember okay. But, at 38,000, that's not bad. That's better than I thought would be a couple weeks ago. And if I make predictions for a couple weeks from now, I hope we exceed those too. So we're constantly driving for it, but we're not at the point where just anybody can anybody for any reason, asymptomatic or otherwise, can get a test. We still want to make sure we're prioritizing those of most need. We've really expanded that definition of most need. That's a great opportunity, but we're not there yet.
What's the availability like of those testing supplies? I don't know if you can think of that as
Yeah, the availability of testing supplies is always increasing. I think that's one of the most positive things we've seen. Working with whether it's the folks at Fisher that provide or Abbott or Cepheid, that's been a very positive note for us. The swabs that we need, we're constantly getting more and more swabs in. So we still have to manage what we have, in terms of coming in and what goes out, kind of manage that balance. So because we don't want to open it up to 20,000 tests one day and all of a sudden we can't do anything the next week. But we are getting a constant increase of supplies in all aspects of and all the different types of tests that are out there. The fact that we have antibody tests, right? That's a pretty. I wouldn't have thought that we were going to have antibody tests running. I think 1,500 or so have been done, maybe already in just the first few days. That's great. A couple weeks ago, I wouldn't have thought that was going to be available. It is. People are taking advantage of it. I almost said Clear Channel. Clear Choice MD is doing a great job getting those out and making it available to individuals. So we keep kind of exceeding where I thought would be, but we're not quite where we want to be, right? So we're going to keep pushing ourselves, and we got a great team on the front lines bringing in supplies all the time. We have a few folks on the phone.
First question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi, thank you. I have two questions, both about charging churches and religious gatherings. The reopening task force indicated today that, unlike with other areas, they won't be drafting and voting on guidance, but rather religious leaders are drafting something that will go directly to public health and to you. So if you could just sort of comment on that different approach. And also, the folks who think that the ban on gatherings of 10 or more people is unconstitutional, particularly when it comes to religion, are planning to gather outside the State House on Saturday, and what would your message to them be?
So I don't know much about if religious leaders from a variety of different areas, I know folks have been talking to them about helping put together guidance. We always want them as stakeholders to be a part of that guidance process. I know Senator Gaida in particular has been working with them, putting in a lot of hours with them, and I commend them for that. And again, I'm not sure what the process exactly will be in terms of the guidance, but whether they want to bring it to us, or the most important part is that it goes to public health, frankly. And everything we do will be open and transparent, of course, but we can work with whether they go to the task force first or whether they come to the governor and most importantly public health first to talk about what that might look like. For me, I don't care about the path as much as just making sure that we get it right. The message in terms of the unconstitutionality of the 10 or less. Look, I guess a lot of people across the country are the constitutionality of whether the government has the ability to limit gatherings. Look, we are in a public health emergency, and of course we have the ability to make sure that we're creating guidelines and standards that maintain public health. These are not permanent laws we're putting into place. These are temporary as part of the emergency order. We hope to flex those open a little bit more as our numbers get better and we feel more confident about what we can and should be doing. I can tell you there are religious organizations in the state that have simply done much smaller gatherings of 10 or less, and they're doing more of their services over the course of the week. I think that's a pretty creative way of doing it. So we want to provide that opportunity for folks. We're not we're not telling people they can't practice their religion. We're not telling people they can't do anything other than making sure that what they have to stay within the guidelines of public health. Now, we're happy to work with a lot of these organizations, and let's remember some of the initial spread of this virus in the community setting was done in a church, and that was a very unfortunate situation. And so I give a lot of credit. The religious leaders that I've spoken to across the state have all, I think, expressed an interest in getting it right, in taking it slow, and making sure that we, whatever we do, maintains an aspect of health and safety. And I feel very confident at some point we can get to a place with guidance documents that meets both their needs and the needs of their community and the needs of those parishioners and the folks in the synagogues and the churches. Whatever we do is going to be the same guidance for all denominations, right? We want to make sure it's truly agnostic. The rules that we've put into place apply to everyone, 1.35 million of our citizens. Man, woman, and child, whether you're in a secular setting or a religious setting, so it is across the board. We haven't segregated any one sector of the community out, and so again, we're happy to work with them on that process. But right now, it is absolutely the right thing to do. Of course, it's constitutional. If folks want to come to the State House and have a voice, that's a great process. I have no problem with that at all.
The next question comes from Tom Easton with the Conway Daily Sun. Tom, go ahead with your question.
Thank you. Hi, Governor. I heard you mention earlier that we did have the snow earlier in the week, and that pertains to the restaurants opening up on the 18th. The people up here in the North Country are going, well, we have state bird of black flies, and we have the cold up here with the snow. So just wondering what you would say to the restaurateurs in Mount Washington Valley about your policy concerning the opening up of outdoor dining, and when will you reassess whether indoor dining is possible?
Sure. So for those who couldn't hear, the question revolves around the fact that we are going to allow outdoor dining this coming Monday, and obviously some of the restaurants in the North Country have colder conditions, of course, than we may have down in the Seacoast area or the southern part of the state. Right now we have a blanket. Our first step of guidance is blanket across the state. Down the road, could we look at different alternatives for different geographies of the state, depending on the data that we see? Yes. For now, for those who can make it work, we hope they can make it work, and for those who it might not work for them, then hopefully we can get to a point where it does. We know that that guidance we put out is not going to be perfect for everyone by any means. But we really tried to listen to the Restaurant Association, work with them on these first initial steps of guidance, and, you know, hope for the best. And, you know, my sense is I think we're going to see a lot of folks actually come out and try to get a table outside with a lot of the restaurants that can operate. You know, it's amazing what I've seen people wait in the rain to get into Market Basket. I've seen people, you know, go to a lot of lengths to just have some flexibility of a normal life and while staying within our guidance. And my sense is there's going to be a pretty good demand there. So if it works for a restaurant, it works for them. If it doesn't, we hope to make it work for them down the road in as quick of an order as we can. We're very cognizant of that, to be sure. As taking my governor's hat off as someone who used to own 7 restaurants in the mountains, I get it. I really do. Someone who used to maintain a tourism attraction in the mountains, closing that up, or hotels. Nobody understands and appreciates the economic impact of what's happening out there more than I do. And it's what keeps me up at night, what's kept me up at night for going on 3 straight months now. But we will get there, but we have to be sensible about how we do it. If we rush just to appease one part of the state or one constituency, we really put everybody else at risk.
The next question comes from Paula Tracy with In-Depth. Paula, go ahead with your question.
Good afternoon, Governor. I would like to talk to you a little bit about lifeguards. And I also have a question about the new version of the CARES Act.
Okay, lifeguards, okay.
Okay, so apparently during the meeting today of the Open Up Committee, a member from the Hampton Chamber of Commerce indicated that you have lifted the hiring freeze that is statewide to allow for lifeguards to begin opening at the Hampton Beach. I'd like to know the rationale for that and any other jobs that may be offered in addition off the hiring freeze. And then I have a question about, I guess there's a new version of the CARES Act that's rolling its way through Washington this week with potential for adding or extending the $600 a week pay differential toward the end of the year. I wondered if you supported that and whether that was something that would help or hinder the state from going back to work.
Sure. So the first question is about lifeguards. Right now, some of the various experts, not just Hampton Beach, but even some of the cities and towns out there are looking. This is typically when they hire lifeguards. And we said, Lakin, we're allowing them to go through the process, but we're not letting them really go, you know, to hire full time, but we're allowing them to actually open that process to get the applications in, because it does take time to make sure that they have folks in queue. They can make sure they meet the physical testing needs and all of that to be a lifeguard, specifically at the state beaches. But I know a lot of the cities and towns that manage their town ponds or things of that nature are doing the same thing. So that's just a job that right now we're not making any commitment to open with any specific date. We hope we get there, but we don't want to get there and then tell them all to go through the sometimes month-long process it might take to hire a lifeguard. So we're trying to plan ahead, but making no commitment, just making sure that we can be prepared if and when we do open up. The second question really revolves around the bills that are being proposed in Washington, the next version of the CARES Act. Specifically, those bills look at the stimulus, and obviously the one that got a lot of headlines was the $3 trillion bill. It's unbelievable we actually talk about a $3 trillion bill, but that is being batted around in Washington, along with a lot of others in different options, both on the Senate and the House side. I believe, if correct me if I'm wrong, Paula, but I think your question was around the $600 unemployment insurance stipend continuing beyond July 31st. Right now, you can get this extra $600 per week in unemployment insurance from the federal government. It's provided an immense opportunity for a lot of our citizens. I can tell you, I think what they're calling these bills are message bills. So in other words, I don't think anyone has any pre-notions that these bills will likely pass in their current form. They're really just setting out some of their priorities. Ultimately, a lot of that will be negotiated with both houses, the Senate and the House of Representatives, both parties, the Republicans, the Democrats, something that obviously the White House will have to get involved in as well. I'll simply say the $600 stipend has been, I think, very productive here in New Hampshire in allowing individuals who are now unemployed not to just go on state or federal services, but still to be able to pay their rent, to pay their mortgage, to hopefully to pay their taxes, put food on the table for their families, going to a grocery store, not having to rely on a massive run on the food bank, although the food bank has had a lot of demand to it, to be sure. But trying to minimize that as best we can, knowing that, or at least theoretically assuming that this is a temporarily very severe bump in the road economically, but a temporary bump in the road. And so I think that was the incentive behind what they were trying to achieve the first time. And I think it's created a lot of opportunity for families to maintain as real, as practical of an semblance of normal life, whatever normal is, as they can as we get through this process. If you were to extend that $600 beyond July, I think it will really depend on where we are economically, what has opened up. I can tell you even some of our Democrat senators in this state have already said that, in their words, that the $600 per week was creating a problem for businesses in terms of incentivizing folks to come back to work. We've heard similar concerns from some of those businesses. So we have to look at really what that, are those just random anecdotes? Is that more of a consistent issue that we're having across the state? I think as we open businesses up across the state, we'll have better data and we'll be able to talk to these businesses to realize, is that a hindrance in terms of people coming back to work? Is it an opportunity for folks at home? You know, what is that balance that really should be struck? Washington, one of the great problems with Washington, and there's a lot of them, is that, you know, when they pass a bill, they're really passing it for all 330 million Americans in 50 different states and additional territories. And so they have to look at things from a very high global level. It doesn't necessarily translate to necessarily the best, what is best for New Hampshire or Oklahoma or New York or California. So we'll look at that data as it comes in terms of how that $600 really impacts the ability for businesses to rehire their workers, to bring them back in, maybe folks that have been furloughed, or folks that have been completely laid off. As those businesses come back in, are they able to drive employees back in? And what is the barrier there? Is it because the employees are concerned about their health? Is it that they just make too much money, being at home? What are the drivers there? Is it a child care issue? All those issues all those kind of variables will be assessed as we go forward in the coming weeks to make sure that we strike the right balance with all of them going forward. And that's a very long way of saying I think it remains to be seen whether that's a good thing or a bad thing. But I can tell you it isn't necessarily what's going to pass out of Washington. I think we still have a long way to go, maybe a month or more, who knows, before a final stimulus bill that's my prediction, the final stimulus bill is really determined.
The next question comes from Rick Green with the Laconia Daily Sun. Rick, go ahead with your question.
Does it make sense from a public health perspective to gradually open portions of the economy and recommend that more people return to work if there isn't capacity to first give all of these returning workers a COVID-19 test?
So I apologize. Can you say the first part of your question again? Is it? I apologize.
Does it make sense to recommend that people go ahead and return to their jobs if not everybody can first get a test?
The answer is, well, we're not recommending everybody return to their jobs because we're not opening everything up at once. What we're doing is putting in these guidance documents that account for the fact that a lot of these businesses won't have the ability to test everyone coming in the door every day. That's why we have guidance documents. If we could test everyone and we had a vaccine out there, I mean, these would be, hugely different variables than we're dealing with today. So that's why we go through the process, a painstaking process, but a very valuable process, working with public health to create these guidance documents, knowing that no one really will have the ability to test everyone walking through the door. So yes, we feel very confident that if folks follow the guidance, it was designed with the full intent of helping and ensuring a mitigation of the viral spread. If people are wearing their face coverings, as many of the employees are, if the folks sitting in a barber chair are wearing their face coverings as they're supposed to do, as long as the salons are limiting themselves to color and root coloring and cuts, as the guidance says, we're moving people through those facilities. We're keeping retail at 50% capacity. All these different pieces that we put into this guidance document are all done knowing that we cannot test people coming in and out every single day. And so that's exactly why we go through the process.
The next question comes from Michael Graham with New Hampshire Journal. Michael, go ahead with your question.
Good afternoon, Governor. Yesterday you tweeted out that the loss of even one life is unacceptable.
Sure.
Tweeting about the situation in the nursing homes, that's understandable. The loss of every life being tragic is something that people can understand and easily agree with. But the one life standard as a matter of public policy is problematic. It's what Eric Garcetti said when he announced that Los Angeles is extending their shutdown for 3 more months. Is the one life standard a standard that you can operate at for public policy, or do people have to understand that no matter when you open up the economy, or if you send people back to school, particularly given that yesterday Dr. Fauci said no vaccine is on the horizon until at least the winter, that there are in fact going to be some lives lost and that you have to balance those two issues? Or is it important to keep the economy in a check by the one life standard beyond the ability of businesses and workers to bear it?
So let's be clear. I tweeted out that every life lost is one too many. That's absolutely true. My tweets don't mean it's a public health standard. I hope we understand that. The public health standards come from working with public health, creating the guidance documents, and moving forward. We're going to be dealing with COVID from both an infection rate, from both a mortality rate, for quite some time. We know that we still have an issue, especially in our long-term care facilities and in other parts of our community as well, where people are losing their lives to COVID. Yet we are still taking what I believe, and I think public health believes, are the smart, reasonable steps to open things up. If you're going to use my tweet as a public policy standard, then, well, that's not very rational. So again, we're going to make the smart steps to make sure we're mitigating this, we're minimizing that loss of life, and we're maintaining a system that can handle the healthcare system that can handle whatever potential surges or whatever else may come down the road. So far, we've been able to do that very successfully. I think the public policy standards that have been put into place are the right ones. They're incredibly difficult decisions, but they are the right ones. But that's a long way of saying, no, a tweet does not define a public policy standard.
The next question comes from Tony Shinella with Concord Patch. Tony, go ahead with your question.
Oh, thank you, Governor. 3 very quick questions, 2 for Commissioner Shibinette. At this point in the department's investigations on fatalities, how many of the 150 deaths had underlying or chronic health conditions, if we could get that? And second, Rite Aid began offering tests Monday to anyone at their drive-through locations in Manchester and Portsmouth, so anybody can get a test here in New Hampshire. But does she know if the results from those tests will be submitted to the state in any way? And Governor, for you, nurses at county correction systems are not being given the frontline worker stipends like their co-workers who are corrections officers, as well as police and fire and long-term care workers. The question would be, should they be also receiving the stipend since they're exposed to the same dangers, and if not, why? Thank
Sure.
you.
So I'll take a couple of those questions, then I'll bring the commissioner up. I'll take the last part first. In that, yes, absolutely, we want to make sure that those workers can receive some type of stipend, and it's something that we are looking at right now. So that's absolutely on the table. The second, I'll answer the second one for the commissioner. Not to step on her toes. I'm sure she'll come up and correct me if she needs to. But of course, those that are getting tested through the Rite Aid drive-through facilities in those 2 locations, and hopefully it'll be more if they can open up. Again, another great private partner. All those testing results will definitely be reported to the state. As far as the number of individuals with underlying health conditions, I don't know. I don't think we have an exact number, but I think it's safe to say a majority of those individuals had underlying conditions, and we can get you additional information.
The next question comes from Harrison Thorpe with the Rochester Voice. Harrison, go ahead with your question.
Yep, thank you. Good afternoon. First off, I asked about 2 weeks ago to get the number of tests taken at the Rochester Armory and also the other statewide sites, like the other 4 or 5 across the state. I still haven't gotten that, and Paul Raymond and Ben both have my email. So, Commissioner Shibinette, I'd really like to get those test numbers from Rochester.
Okay, so sorry if I might. So I just want to make sure, because we're going to write this down. Looking for the total test numbers out of Rochester, as well as the other fixed locations across the state. Is that what you're asking?
Well, yeah, Rochester's the most important, but I mean, if you can get me the other tests, that'd be great too, just for a comparison to break it out.
Okay, we can definitely do that. Yeah, I apologize.
Okay, thank you. Also, this is also really for anyone, but can you give us a sense of, given the recent trends, when we might see the percentages of deaths to cases, confirmed cases, and go down, and the hospitalization to cases rate go down, and then maybe seeing the recovery rate go up, which still looks, way down in the 40s. And lastly, are we progressing with the CDC guidelines that came down about a month ago? And are we seeing a steady decline every 2 weeks?
Thank you. This is Commissioner Shibinette. I'm going to try to answer some of those questions. So as we increase our testing, I don't expect to see the actual number of daily positives start decreasing. I think it's going to vary day to day depending on the number of tests we do. And what we look at is the percentage of positivity. And we want to watch, what we wouldn't want to happen is to increase our testing and then see our percentage of positivity increase with our increased testing. We want to see that continue to drop. And we have seen that pretty on a downward trend for the last couple of weeks. When it comes to the hospitalization, there's a lot of factors that are impacting the hospitalization rates. And when you dig into those numbers, it's not just active hospitalization. So one of the things that we found is that of those 120 hospitalized, we're including acute care rehab in that. And there's about 25 beds of acute care rehab that weren't filled. Maybe 4 weeks ago, we didn't have those at Northeast Rehab. So those are for people that have extended stay, that may have a length of stay of several weeks or several months beyond the phase where they need an acute bed. They're included in that total. We also have elderly people that are in the hospital and are not able to discharge back to their long-term care facility because of COVID and not being cleared for the test. Right now, we're requiring 2 negative tests. So although they don't need hospital level of care, they're still testing positive because there's residual COVID virus in their system. So they end up with an extended length of stay that may go to 3-4 weeks. So they don't necessarily need the bed, but they can't go back to their nursing home. So there's a lot of factors that are playing into that steady or increasing hospital rate, and it's not necessarily reflective of additional new active infection.
Thank you, Commissioner. She's wicked smart, huh? That's awesome.
You might have a follow-up for Commissioner Shibinette?
Oh, sure.
In regards to the outbreak at the Hillsborough County Nursing Home. On a call today with other nursing home administrators, David Ross, the administrator there, said he was really struggling to get PPE in the weeks ahead of the outbreak. Do you think the lack of certain PPE items like gowns exacerbated that outbreak that we see now?
No, I don't think that the lack of gowns exacerbated it. I think people were conserving it more than they typically did. Gowns was the limiting factor for us for probably several weeks. We have them in now. We emphasized and prioritized anybody that had any positive cases at all. So I don't think it exacerbated it. I think that had they had positive cases, that it certainly could have been a contributing factor to it spreading more easily. But I know that I talked to David Ross too, and he talked a lot about they were doing everything right, and I've talked to administrators in these outbreak facilities pretty much every day, sometimes multiple times a day, and we're consistently hearing stories, and even from Hillsborough County, that they had one positive staff or one positive resident, and they did not expect to have 20. I think the number's 28 today, and the majority of those additional 28 were all asymptomatic. And we're hearing that over and over again in long-term care facilities, that even older adults, some with underlying conditions, are still testing positive and are asymptomatic. So I would encourage any nursing home that has a shortage of PPE to contact me, either through our ESU or to me directly. No one should have that degree of shortage of PPE that they think that it's impacting patient care.
So what is the present number of homes, long-term care facilities where outbreaks are considered to be active? Is it still 13?
There's 16 on my list, and all of which, they're not all long-term care though. So the transitional housing in Manchester is on the list, and Easter Seals in Manchester is on the list. So, and there will be There are several that are right at that 10, 11, 12-day period that if they don't have further cases by the end of the week, they're going to be coming off. So some of those earlier outbreaks you're going to start seeing winding down, closing out, and not being in active status anymore probably by the middle of next week. That is what we are hoping for, and that you're going to see a wind down of the earlier ones.
You said 7 of the 8 deaths today were long-term care related. Any details on the 8th death?
I don't have that, no.
Just one quick question on antibody testing. In this, what sort of guidance is given to people who have received an antibody test about, you have a positive result, how should you behave? Does that mean that you can...
So we do a full investigation on every positive antibody test, just like we do on a PCR test. And we actually have cases of positive antibody testing that we've done a case investigation on and been able to find through contact investigation people that were associated with that person that are testing positive for COVID. So we treat antibody positive tests just like positive. Now we don't say, if you can identify that you were ill 3 weeks ago, we want you to start your 14-day quarantine right now. But we treat it in the same way that we do the full contact investigation on it. It really is about, do you remember having symptoms? Who were you around? Where could you have gotten it? Who could you have had close contact with? But if you're not symptomatic and you're not showing active signs of infection, we're not going to quarantine or isolate you. Based on my conversations with public health, the epidemiologists there tell me that it takes about 14 days after infection to develop the antibodies that will show up on an antibody test, which is past the point of time that you would be asked to isolate or quarantine anyways. But full contact investigation, we're actually getting really good information out of those contact investigations.
Last one for you, Governor.
Sure.
Here. The Libertarian Party of New Hampshire says it's going to sue the state if you guys don't relax the in-person petition requirement.
Sure.
Of 3,000, essentially. Is that something you'd consider to?
We're really not. Yeah, I'm really not involved with that at all. I mean, if they choose to do that, that's fine.
Would you relax the requirement, though?
No, well, I'm not. I'm really not even looking at it. So no, we're not looking at relaxing the requirement. There could be even a conflict of interest issue there, because it would be looking at making a judgment call on somebody that may be potentially running against me in the future. I don't even want to make a judgment call on that. Like, if they have to take it to a court, take it to a court, or deal with somebody else. But I don't think it's appropriate for us to opine on that at this time.
Apparently Governor Raimondo is considering potentially making people who are planning to vacation in Rhode Island this summer be tested for COVID before they arrive. Is that something that you would consider?
Potentially. I hadn't really thought about it in that aspect. We've been looking at different types of models, everything from how do you manage like a sleepaway camp? If kids were going to go to sleepaway camp, do we require testing before a kid were to come to sleepaway camp? Because that's a very tough one, and so we're trying every which way to see if we can get those going, but those are one of the biggest challenges we have. So I don't know. I mean, I was on a call with an NGA, National Governors Association call, with a lot of other governors earlier today, and the NGA has, I think, done a very good job making a lot of their guidance and recommendations that all the different governors are undertaking in their states, kind of going to a central repository, which everyone can kind of take a look and see what other ideas there are. So, I mean, that issue didn't come up per se, but with this unknown situation, everything's on the table. If someone has a good idea, I'm open for any really good ideas, and I know Department of Public Health is too, but you have to see, okay, who's in charge of that test, how soon do they have to submit it? Because remember, a test will tell you you're okay in that moment, but not necessarily that you didn't get infected a few days later. So, what's the window that you'd make that request? How is it done? How is it transmitted to the state? Are you affecting HIPAA? All that kind of stuff. So everything's on the table, so we'll see where it goes.
You've said it a couple of times this week, so I have to ask. How many hours of sleep are you getting? And are you doing anything different?
Do I seem cranky? Do I seem cranky with?
No.
Yeah. I've had a couple of decent nights. I'm not going to lie. It's been tough. It's been very every day is something completely different, right? And that's the challenge, and we're up for it. We got a great team. We're absolutely up for it. But something might come up at 7 o'clock at night, and there's no direct answer to it. It's hard to just put your head on a pillow and fall asleep when you don't. When there's whatever the next unknown problem is. So sometimes I will lie awake, or if I'm doing my birthday cards, I think well when I'm doing all those birthday cards. But and just thinking not, okay, I have to solve this problem today, But, okay, what are the variables we need to look at? Who else do we need to reach out to? What other stakeholders should be involved in the decision-making process? What's appropriate? Do we get the Attorney General involved in this or that? So a lot of times it's strategizing about the path forward to make the best decision, not just trying to make the best decision in that moment. And again, looking at all the different skill sets of the team we have. And as I always say, we have an awesome team here. We're very blessed with a good team. So I don't know. If when I get cranky, let me know. But I'm trying to stay as positive as I possibly can in some really tough times. I think a lot of people are. And, you know, this EOC, this Emergency Operations Center here in Concord, I mean, it's effectively a 24-hour operation. There are folks that have just been doing incredible work. All the contact tracers that we have, that we're kind of renting new facilities to just keep this army, if you will, available and out there doing the contact tracing, much of which other states had abandoned and now are coming back to. We never abandoned it. All the folks that are managed, the hundreds of people that are in our unemployment insurance or the employment security call center to manage unemployment insurance, they're working tirelessly and many, many hours. So, you know, I'm not looking for any sympathy because there's a lot of people out there that are completely exhausted. Think of every single nurse, every single doctor that is out there in these facilities working double shifts, multiple days in a row, time and time again, not even being able to go home to their families often because they have to be quarantined, right, for weeks and weeks on end. So, you know, we all have our part to play here. And if I get grouchy, you let me know, but my staff keeps me pretty positive. Coffee and chocolate, that is how I'm getting through a lot of this, unfortunately. I probably need to start exercising a little bit more, but we'll get there. Okay, well, the weather's going to be great tomorrow, so I hope everyone enjoys it. Spring is definitely here. We'll be back probably on Friday, I think is our next planned press conference, and we'll talk a little bit about where we go with the Gopher Committee and, you know, anything else that might come up in the next 24, 48 hours, because that could be anything. So be safe, everyone. Have a good one.